our culture of care conversation is we have Mrs. Merle Scarce, who's an Aboriginal lady. She's from the Nullarbor Eyre Peninsula, and you'll pull me up.
Port Augusta area, Port Domain, also the Yorks Peninsula.
Yep. And Merle's, she's been married. She worked prior to that. She's a nana of 11.
Grandchildren
by a lot. And Merle's interest in the last 8 years, she's been in a wheelchair, obviously, and she's worked closely because of rheumatoid arthritis, has had to work in partnership with occupational therapists. Now, Mark is her occupational therapist, extensive experience in the community, based in aged care rehab. He's the co-director of the Inspire Therapy, an Adelaide-based private allied health service, and the philosophy of, he's doing PhD in frailty in older adults. Sorry, I didn't bring my glasses, I should have. So, as I said, Mark is an occupational therapist, and we thought it was really important to listen to the partnership that these two have formed in this process and how that actually works towards our goals in the future. So please welcome Mark and Merle.
Thank you. I think that's on. Yes. So as well as our partnership, I'm going to be asking Merle some questions about her partnership in her recent experience in hospital admission to the Royal Adelaide, and then a rehab admission at Flinders after a fall where you fractured your femur and had surgery and went through quite an extensive rehab process before returning home. Mm-hmm. So really, to set the scene, Merle, I want you to just explain what are some of the challenges that you face in living your daily life.
Now you're talking about?
Yeah.
Very limited movement, my body. I can't use my fingers or my hands very much at all due to my rheumatoid arthritis. What else?
That, and you're pretty much confined to the wheelchair.
Yeah, confined to the wheelchair.
Yeah. And we heard earlier about some of the technology and technological advances that are coming. What's some of the technology that you currently use that helps you to remain healthy and independent?
I have a monitor for the emergency services
So
that I pressed. A monitor alarm that I would press if I needed to. I have the mobile phone, of course.
And that mobile phone, as they've improved, has made a big difference to you being able to access
the outside world.
Outside world information and resources.
Yes, I wouldn't part with it for the world.
Yep.
And also...
we had some of your remote controls.
Remote control for the TV. Yeah. But I'd love to have... Go on, Mark.
Oh, yeah. We were talking in the session with the group about what technology Merle would like to see. And that was around voice activation.
Voice or face recognition. Yep. To open doors and lights and through the mobile phone.
So pretty much to do the things that your hands are limited in doing.
Yes.
Yeah. And then we're going to talk about your experience in being in hospital at the Royal Adelaide and at Flinders. What were some of the good features of the care that you received while you were there?
They were very good, physiotherapy and occupational therapy, as well as the doctors, and they were excellent in their care. We also made a planned care for when I would go home.
So you sat down with them and worked out goals
together? Worked out goals, yes.
Yep.
For home.
So some of the things, we had a conversation before today just to talk about some of the points, and you said that you felt like you were treated with respect.
We're treated with respect.
Yep. And you're given lots of encouragement.
Lots of encouragement, yes, and Yes, they were very, very good in the hospital. Very good at the Flinders.
And then you felt like you were listened to as well?
Listened to with respect.
And then, when you set those goals, and then I asked you, did you achieve your goals?
Yes,
Did
I
you
did.
feel like you did? Yeah.
I did, yes.
So, and by that you got home, and you're now living back home independently.
Independently.
With,
Very
with,
independent.
With supports.
Yes.
But then we also talked about some of the negative features.
Not been listened to sometimes, not that often, no. Such as they put a brace on my leg and I knew my knees are fixed, and they put a brace on, and I was screaming in pain, and they come back and took it off. But they said, they were only taking orders from the doctor, and they wasn't listening to me.
And I think you also said that they said to you, "We know what we're doing."
We know what. Oh, this is another incident where I said, now the nurse said, "Oh, we're going to pull you on the side of the bed," and I said, "Yes, we'll do it this way because I know my body." And she said, "Oh, we know what we're doing," and she just yanked me, and I screamed at her. And I don't like to be like that, to scream at somebody.
And that goes back to we were talking about who has the expertise in your body and understanding it. And that's
I do.
yeah, and that's you. We heard earlier as well about racism in health services. And can you tell
Well,
me?
sometimes, yeah, they would look at me like, oh, this old Aboriginal woman, as if they knew better than me because of my colour.
And you said to me that sometimes it wasn't necessarily what was said; it was around like the tone or the interaction. Is that-
The interaction. Interaction. You pick it up, you feel it.
And that wasn't just about being Aboriginal as well. You mentioned about being an older person.
Older person also. Young ones, who do you think, we know better than you? You're just an old woman.
Well, and really, you know a lot. You know a lot about yourself.
Well, yes.
And then we've heard a bit today about being in a partnership with the people that provide you healthcare. So, do you feel like you're in an equal partnership with like your GP?
Yes, I am. My GP's my nurse. She looks after my care plan. I go to see her every 3 months. My doctor is. Could I say that about her being Indian?
Yeah.
She's Indian, and she's had the same colonial history as the Aboriginals in Australia, so we have that connection. And she's warming now a little bit towards me, a lot more.
So it's taken a bit of time to build that friendship relationship.
Yes, yes.
Yeah. And so when you're reviewing your care plan, how does that process work between what she suggests and what are your priorities?
What my priorities are, what she suggests, and also the nurse too, what she suggests also. She's very good.
So you have a say, they have a say.
Yes. Yeah. And they do ask me, what I would like done in the way of the medical service, yes, to me.
And then another important part of your life has been the home care package that you've been receiving for 2 years now.
Oh, that's excellent, because years before that, I was really struggling with my life. With the package 4 now, I've got can I say commodes and stuff like that?
You can say whatever you like.
Commodes, and I've got a gopher and
Well, you've got support services as well.
support services. I've got a lot more things happening for me now than what I did when I didn't have that. Thank goodness for the package 4.
Because what difference has it made to your health and well-being by having that support?
Oh, I don't know. I don't know. What do you mean by that?
Oh, earlier you were telling me about feeling more relaxed and...
Oh, yes, a lot more relaxed, a lot more content, not so stressed out as I was in the past.
And you mentioned as well about the relationship with your family, that having that
Yes,
support has helped.
with that support system in place now, I don't have to rely on my family as much.
And how would you describe our working relationship, so you and me?
Mark and I, we do have a really good connection, and yeah, he's very, very. Can I use the word? He listens, and I consider him to be a very kind man.
Oh, thanks. But sometimes as well, you present problems to me.
Yes.
And I try and help you work out a solution.
Yes.
Sometimes
yes.
they don't always work, do they?
No, not always. No.
I guess how do we go about working out a solution that does work?
Well, you throw ideas at me, and I will think about it, and then I will let you know what.
And generally, it's what you let me know is what's pretty much going to work in the end. And then, I guess to finish up, I asked you before outside, what's the most important thing in your life?
Me. Me and my well-being.
I think that pretty much sums it up. Yeah. So you are you're the centre of your life.
I am. I never did, but I am now.
And
Took a long time though.
And I think it's important for every health practitioner to realise that for each individual that we work with, they're the centre of their own life, and
Yes.
they're the experts in their body and their experience
Yes.
and their priorities.
Yes.
So I'd like to thank Merle for coming in today and sharing her story with us. I think it's been a really valuable experience.
And thank you everyone for listening to me.